Good morning. On behalf of Impart Alliance and Community Services Network, we'd like to welcome you here today and welcome you to our team and to this in-person portion of your Trainer Certificate Training Program. My name is Dr. Clare Luz, and I am on faculty in the College of Osteopathic Medicine at Michigan State University. And I'm also the director of Impart Alliance, which is the organization that administers building training, building quality, and the Trainer Certificate Program that you are now in. I would like to take the next few minutes to talk with you a little bit about Impart Alliance, this program, what to expect, and perhaps answer some of the questions that you may have in advance so that you're not anxious about things over the next few days. So let's start with an overview about how all of this came about. Some of which you may have already heard, or you have handouts on because of the previous Zoom meetings, but I'd like to paint a fuller picture just to give you an idea of the context within which this program is taking place. And I feel this is important for several reasons. It will help you understand what you've signed up for, how it fits into a larger context, because this isn't any old trainer training program. You have signed on not just to personal growth, which is of course very important, and we are invested in that as well, but to a team with a larger mission, and we will be working together as a team. This team is a group of people and organizations who highly value personal care aides, or PCAs for short, and the work that they do, and have advocated for years and continue to advocate for better training, but also for better working conditions and for society to place a higher value on the work that they do. In 2016, Impart Alliance received a large grant from the Michigan Health Endowment Fund to help build an infrastructure in Michigan to support this workforce. We're building an organization, one that will be here long after the grant money is gone, one that is already getting national attention. And training is central to our mission, but as I mentioned, we have other goals as well that involve advocacy work on behalf of PCAs, such as higher wages, more benefits, guaranteed hours, more respect. We are hoping to scale up BTBQ to be used across the state and nationally as well. We learned very quickly that this was impossible, would not be able to happen unless we had highly qualified trainers and master trainers. We're in desperate need of excellent, high-quality trainers for BTBQ, and this is where this training program and you come in. People ask us, why is BTBQ so important? Why not just train all direct care workers as certified nursing assistants or CNAs? What's the difference between the BTBQ program and the CNA program? This is a question that you will get as well, and you should be able to answer it with pride. One of the biggest differences is that the CNA program is what is referred to as a medical model. BTBQ is what is referred to as a person-centered model, meaning that person-centered thinking forms the foundation of all of our modules. It's woven throughout all of our modules. So it's not just about how do you give somebody a bath, it's how do you give them a bath in a person-centered way, where you're respecting their wishes, honoring their values and their preferences. Another big difference is that the CNA program has no home care component. And we all know how different it is to provide care in somebody's home versus in a nursing home. There are many skills that the home care workers need to have that are not taught in the CNA program. This is all very relationship-based. It means that the personal care worker needs to get to know their client. Another difference is it's taught primarily using adult learner teaching strategies, which means there's no talking head or PowerPoint presentations. It's all interactive, and it makes it assumes that people are coming to class with a wealth of knowledge already from previous education, training, experience, but from life experience in general. And that those are strengths that can be used to help them succeed in class. So what separates this trainer program from other training programs? There are several things I'd like to showcase here. We are hoping that this will be a group of people that are diverse, for starters. They bring different perspectives to their role as a trainer or an instructor. This means that we have a healthy respect for all of the professions. Whatever profession you are in right now, we have respect for it, including personal care workers and their potential role as care providers, but also as instructors. Another big difference I mentioned earlier is that we work as a team. You'll be working closely with us. We are making the assumption that you are all experienced and familiar with the technical skills of being a PCA. And we don't need to focus on learning how to do those technical skills like the ADLs and the IADLs. You're going to be learning how to teach PCAs to provide these skills using the BTBQ curriculum. Therefore, one of our goals is to help you become familiar with the BTBQ program and the content in all of the modules. Some of you have lots of experience teaching, some maybe not so much. For those who have experience, it may not have been in healthcare, or it may have been in a nursing home where all of your anecdotes and stories and examples are nursing home based. Some of you may have taught and you've taught in healthcare, but you may not have used adult learner teaching strategies. If you did, you can help your classmates strengthen their skills in these areas. So a second goal for this training program is to help you become familiar with being an instructor and with adult learner teaching strategies. We want you to apply these teaching strategies to teaching BTBQ. Ideally, we also encourage you to engage in team teaching, so we would like you to become familiar with that as well. Another reason why BTBQ is so important, our story, your story, is against the backdrop of an aging population that is responsible in part for a critical shortage of direct care workers right now. We need more of all of the disciplines. We need more geriatricians. We need more geriatric nurses, but we especially need more PCAs if we want home care. The statistic that stuns people the most, I think, is the fact that we, right now, we need 34,000 more PCAs in Michigan than we already have. How are we supposed to get 34,000 more workers? And we don't want just warm bodies, right? We want people who know what they're doing, who have the technical skills, but who do these skills in a person-centered way, who are kind, who respect their clients, and who want to stay on the job. The turnover rate among personal care workers right now is astronomically high, and it's not sustainable. It churns up the system, it destroys continuity of care, and we have to stabilize this workforce. Good training helps to do this. It can lead to lower turnover rates in addition to better client outcomes. It's also a time when there's an effort to move people from nursing homes into home care, into their own homes or some other community setting where most everybody wants to be. And we can't have home care unless we have a home care workforce. This is why what you are doing is so very important and why we're thrilled that you're with us here today. What are some of our longer-term goals? We're working on professionalizing this workforce. We're starting a PCA professional association, establishing competency guidelines, ethical standards, professional standards, and other member benefits. We're hoping to issue credentials that are industry endorsed. and some of the other things I mentioned earlier, like higher wages and guaranteed hours. We are now able to offer this trainer certificate program. We're also in the process of piloting a master trainer certificate program. And we're hoping that some of you, when you finish this program and you've had some experience in the field, that you'll want to join us as a master trainer. Let's talk now for a few minutes about logistics. We know you have a lot of questions, and that's okay. And your master trainers are going to help you answer those questions over the next couple of days. We may not have all of the answers. Our answer might be, let's figure this out together. Because we're fairly new and we're growing, things might come up that we're a little bit uncertain about. But the exciting part of that, the plus side of that, is that you are part of something new and growing and exciting, and you can be part of how it evolves and develops. Once we are done with this 3-day session, there are some remaining requirements for you in order to get your certificate. There's a minimum of 4 practicum sessions that are mentored and observed. And by practicum session, what I mean is that you will be setting up a class, a BTBQ class, that you will teach as the instructor, and it will be observed and mentored. And you'll be able to get experience teaching BTBQ PCA students. We highly encourage you to have at least one of these sessions done within the first 30 days of completing this in-person session. Some of you may need or want additional practice sessions. You might want more than 4 or need more than 4, and we will help you determine this. Over the next couple of days, the master trainers are going to take you through how to do this, how to set up these sessions from start to finish. You're going to receive a handout with step-by-step instructions. And it's important to say that you should start early, follow the recommended steps, talk with your supervisor, agency, owner, whomever, because you will need their buy-in. The sooner you talk with them, the better. We will be setting up a time to talk with them as well. If you are independently employed and you are not affiliated with an agency, there are several options for you, and we'll talk through these with you. And we'll do our best to help you set up classes to fulfill your practicum requirements. Who pays for these classes? If you're affiliated with an agency, the agency will be paying for these. They will have to enter into a subscription agreement with CSN and with Impart Alliance, which is why it is so important to have administrators on board from the get-go. Some agencies will charge for the classes, or they'll apply for some grants, and we can help them do that to help recoup some of their costs. Again, if you are self-employed, let's talk about your different options. How much are these classes? You will be learning more about that as well. We have worked out a cost structure, and that will be discussed with your administrator or the owner when we are developing an individualized subscription agreement for them. If other logistical questions come up, and they will, please let us know. If you're concerned about something, it's probably true that your classmates are as well. So please raise it up as quickly as possible. And if your trainers can't answer the question, they will bring it back to the core team and we'll all answer it together. Finally, let's talk just for a few minutes about expectations. I want to throw out the word fidelity. I know you've heard it several times already in the 2 Zoom meetings. You're going to hear about it more over the next few days. We take it very seriously. It is one of the reasons why each of you have signed a licensing agreement. It is you that holds the license, which means the right to use this curriculum. It's not the agency that holds the license, not anyone else that you know or work with. This is why only Impart BTBQ certified trainers can teach BTBQ modules if the goal is for the learners to eventually receive a BTBQ diploma or graduation certificate. It's why copies of manuals and training materials are not to be shared, reproduced, used by non-BTBQ approved trainers for anything that's non-BTBQ related, or in any way used towards something that amounts to a BTBQ-like certificate. Violations of this agreement will result in the instructor no longer being able to teach BTBQ classes or work with In-Part Alliance. There are 3 main reasons for this. The modules are taught the same way by every instructor in every location so that all of the learners receive the same materials in the same way. Much like the SENA programs or a college, university accredited program or any accredited classes, they need to be taught in such a way that they maintain high quality standards. This is especially important for BTBQ because it's considered an evidence-based program. It has been tested with research findings that would be invalidated if we changed the program in any way. We're going to talk a lot more about this going forward, what changes are okay and what changes are not okay. And if you have a good idea for changes, you think you have a good idea, then there is a process. You can bring it up and let us know, and we will vet the idea and figure out if there's a way to incorporate it into the current content. The third reason is because all of the content is copyrighted. It is intellectual property that belongs to the authors, and it's protected by copyright laws. Another expectation is communication. Communication with Centro, with us, is essential. And you will learn that the first step in setting up a class session is to contact us and let us know what you have in mind, and we'll work with you. We ensure that the subscription agreements have been completed, that they're in place before any class is taught, which is why we need a little bit of lead time before you start any classes. We keep the class lists, we process all the paperwork involved, we track which students have completed which modules, we issue the training certificates, so you can see why it's really important for us to stay in close communication. We also collect data for research purposes on the students, instructors, on the agencies, for a lot of reasons, for research purposes, but also to justify continued funding, to determine if there are needed changes in the program, and helping us to do this is part of the trainer's responsibilities. There are forms for students to complete before starting classes. There are forms before and after each class. There are forms for you to complete. And then we ask that you let us know if you don't want to participate in this program as a trainer any longer, or if you change jobs, careers, organizations, so that we can either cancel your licensing agreement or we can modify it as needed. I'm just going to mention a couple of more expectations. We hope that you will support each other. You will find that getting to know one another and building some relationships among this cohort of trainer candidates can lead to a supportive network that is going to serve you well long after this in-person session. We hope that you will be champions for BTBQ. It's a program to be proud of, and you can help spread the word, you can help scale it up so that it's taught not only across the entire state, but eventually across the nation. And finally, we hope that you have fun. This should be exciting, rewarding, enjoyable for you. So now relax, learn, enjoy, and once again, welcome to the team. I look forward to working with you in the days and months to come. Thank you.